Hey everyone, it's Steven from Tostemac, and joining me today is my mom, Miss Ellen.
Hello everyone.
Originally this video was supposed to be about autism and networking. However, some of the fans of Tostemac have been reaching out to me saying how they're being affected by a certain predicament, if you will, and it's affecting a lot of the fans. So I figured that's hitting a bit too close to home for me. So instead, I want to make this video to talk about what's going on right now, and that is involving the coronavirus. Now, for those who have been listening to the news, reading what's on social media, you'll probably have a good idea on what's happening right now in terms of like what is the coronavirus and how it's affecting our society right now. However, there seems to be quite a bit of misinformation going around, and we want to do our best to clear it up. Now, we're not going to try listing numbers or statistics because A, the news stations have already done enough of that, and B, well, we want to keep this video as relevant as possible because we don't know when the numbers are going to change. So, Mom?
Okay, thank you very much, Stephen. So I appreciate the opportunity. Knowing the audience that we are speaking to, I just wanted, first off, to let everybody know, do not panic.
Yeah, that's going to be one of the biggest problems and biggest obstacles we're going to face. And I think the whole toilet paper incident is a perfect example because when people started first hearing about the coronavirus and the possibility that it could come here, people were buying like 4 to 5 packs of toilet paper, like huge packs. Like I saw it at my workplace because we have toilet paper at the Home Depot. And I was thinking like, oh, that's quite a lot you got there. And they were telling me that they were worried about the possibility of if one of them gets it, then the whole family could be quarantined for about 2 months, which I just find that hard to believe. Like, from what I've been told, if you were to get this coronavirus, you just had to self-quarantine for 14 days. That's 2 weeks, not 2 months.
Well, hold off before you go to that.
Oh.
The first thing I want to do is to tell everybody, people love to tell stories, and they don't like telling the good ones. They only like telling the bad ones. And unfortunately, the news media today has been charged as guilty with this. And in some instances, it's been proven that they do tend to exaggerate so they can get the better rating. So what I want to do is first and foremost educate you. If you are looking for the most accurate information, you want to go to the cdc.gov/corona. Now that is basically coming from the horse's mouth. These are the people that are responsible for collecting all the data of anyone in the United States, as well as comparing with data from the other countries in the world about who has been exposed, who has a positive test, who has died from it, and who has recovered from it.
And I'll leave a link in the description down below so you can check it out.
Okay, so I'm going to encourage each and every one of you. Yes, your friends are all going to have a story. The news is all going to have a story, but go to the source, go to the expert, get the information from them. And as following my own advice, I here am looking at the coronavirus disease, which is COVID-19. So we're going to talk a couple of symptoms. Now, after someone has been exposed to someone who has the virus, what you're going to find 2 to 14 days after exposure is when symptoms will occur. Some of the symptoms include fever, dry cough, shortness of breath.
Shortness of breath is a very important thing to remember because I looked around during work and also other social environments, and a lot of people were, I don't want to say paranoid, but I think they were kind of jumping to the wrong conclusions. Like if they were seeing someone coughing a lot, then they would automatically assume, oh, coronavirus. But just because you have a cough, just because you have a fever, doesn't necessarily mean you have the coronavirus. It could be due to other factors.
Now, one thing I'd like to point out, and I'm hoping all of you caught that, when Stephen was imitating someone coughing, Stephen, show them again what you did. Okay. So, because if you cough into your hand, folks, you touch your face, Okay, so
Well,
that's,
not like that, but you're also shaking other people's hands.
well, that's true. But the other thing is, then they're also touching other items. So the safest thing is, in fact, and it has been proven, that coughing into your elbow is the safest place to catch the majority of the germs. Okay? So that's the first thing that I would like to say. Now, some of the emergency signs, things that tell you, yes, you are getting into trouble, above and beyond. If you're having difficulty breathing, clearly you need to call 911, okay? That's nothing, because there's not a guarantee that it's just the COVID, and I'm not putting COVID down or the coronavirus down. What I'm saying is shortness of breath could be from a lot of things. Persistent pain or pressure in the chest, again, that's a 911 call, folks, okay? New confusion or inability to arouse, that's pretty severe. Or the bluish lips of the face. Now, in all of these, if you're seeing these symptoms on your loved one, then yes, you do need to get emergency service. However, if you're at home, you're developing a fever, anything up into and including 100.1, 100.1, not 101, a dry, non-productive cough, body aches, these are the kind of symptoms that you just want to call into whoever your healthcare practitioner is. Do not go to a clinic, to an emergency room, or to urgent care. Because think about that, folks. If you're going in there, if your immune system is compromised with this virus, now you've got this issue, but you're also now exposing yourself, as well as others, to whatever else is sitting in the room.
Yeah. Sorry. And a couple things I want to point out is that a lot of people will probably be going to like the hospitals and emergency rooms anyways.
And they're getting turned away.
Yes, they might get turned away, or maybe they might not have enough room, so that's a concern. Mm-hmm. Also, I think there's a key detail I want to mention about the coronavirus, and it's something you hinted on a little bit just now, is that from what I'm seeing, it seems that the majority of people that's been dying from the COVID-19 virus is elderly people and those with poor health history. So some might be thinking, well, it's not that big of a problem. And I'll admit I was guilty of thinking about this as well. But here's where the bigger problem comes in. Suppose I had the coronavirus for some reason or another. Like, I'm young, I'm healthy, I shouldn't have a problem. But the problem is, when a younger person gets infected with it and goes out, then in a way, that individual becomes a carrier for other people to get infected.
Mm-hmm. And so the other thing is, when you do come into contact with people, there are certain precautions that you could and should take. Number one, when you meet somebody in the street, hey, works just fine. You don't need to shake hands or necessarily hug. The recommended distance is 6 feet apart from each other, okay? Only go out when you need to go out. Now, each state has different guidelines going, and again, if you go to the cdc.gov, then they will probably have somewhere about, you can look at your individual state or listen to your local news to tell you, are you on lockdown or are you just being recommended to stay at home? Now, some of the other things you're going to want to do, there are some people that are going out and they're buying masks. Please don't do this. Number one, those masks really are needed by the medical personnel.
And constructors too. Because like at the Home Depot, we sold like a whole bunch of those masks. And I've been hearing like contractors, painters who need those masks and
to do their
jobs. We don't have any now.
Right. As far as the age group, yes, it would appear that it is the older group. But here recently we have had reports of people in their 20s and 30s that have died. So wash your hands. Now, washing your hands is the most important thing that you can do to protect yourself and someone else. The best way to do it, and I'm going to do a very quick demonstration. So I'm going to put the water on. I'm going to put the soap in my hands. I'm going to be getting the back and the front of my hands. I'm going to go down a little bit on my wrists, okay, get between my fingers, and I want to do this for 20 seconds. After I have finished 20 seconds or singing happy birthday, I'm now going to rinse my hands under the water, okay? Let the water run, guys. I understand water shortages, but this is more important. And so now, after you've finished washing, you've rinsed your hands and you've shaken all the water off. Don't worry about wasting water. Get your paper towel or whatever you're going to use to dry. You want to dry from your fingertips, down your hand, and then to your wrist on both sides. Throw that away, get another paper towel. Use the paper towel to turn the water faucets off. Remember, you touched those faucets with dirty hands. Your hands are now clean, so you don't want to self-contaminate by touching those faucets again.
Okay, so those are some basic steps and procedures in terms of like keeping yourself clean. Now, in the chance where you do have, or you might show signs of the coronavirus, then you're going to want to stay home. Like, as I said before, self-quarantine for about 14 days. Now, a lot of people may be concerned about their work because, like, a lot of businesses are trying to shut down except for, like, deliveries or essentials. Thankfully, the Home Depot I work at, they got us covered. They've given us extra sick hours. They got a plan where if we get test positive, we could just take 14 days off to recover from that, and it won't eat up our sick or vacation hours. So in terms of job security, I'm good. Nothing bad's going to happen. But I do understand the concern that other workers might not have that safety net.
Correct. So one of the things that you want to do is have a conversation with your boss and find out what is the company's policy. Now, please understand, if your company doesn't have it to give, they're not being stingy. Nobody expected this to come, and it's doing very real damage to a lot of companies.
Yeah, because I think you were saying that even in your time, we didn't see anything like this. Mm-hmm. So this is uncharted territory for everybody.
So the thing that you need to remember is have those conversations now to understand. And remember what I said, please go to the CDC, cdc.gov/coronavirus or just corona, okay? If you go to this website, those are the experts. Any information you need will come from there, okay? And again, just please be safe. It's a droplet spread of infection, so 6 feet away, wash your hands, and if you don't have sanitizer, it's nice if you have it, don't worry. Just wash your hands, don't touch your face, and Stephen, let's do an elbow bump.
Yeah, the Home Depot's been doing that a lot lately.
Okay.
One more thing, and this was actually something that was said during one of the president's statements and whatnot. He mentioned a possible solution or an idea to work on is social distancing, which kind of sounds ironic with me having autism and not having good with social skills and all. And we all like to socialize with each other, but now we're being told to distance ourselves. But this is only temporary. The idea is to stay away from crowds or not make crowds of 10 or more. What this does is it drastically reduces the chance of the coronavirus spreading further. Now, I know it's probably already been spread to all 50 states. There's like a national emergency going on right now. Mm-hmm. But if we stick with this plan, if we just keep our distance for around 2 weeks or 30 days or however long, then we have a chance to slow down the spread of the coronavirus.
Mm-hmm. We will. And again, I'm going to send you back, cdc.gov, corona.
Geez, if I hadn't known better, I'd say the CDC would have been sponsoring us.
You know, if we want to see this through, and we can see this through, it's like the story of when you're in a boat. If everybody's rowing the same way, we'll get to our destination. That's what we need to do.
And again, that, like she said, involves everyone pitching in to help with this, because we're only going to be able to get through this if all of us work together. So, anyway, so I want to thank you, Mom, for taking time to help me make this video. So it's really important.
Thank you for inviting me.
So, like she says, if you want the information on how the coronavirus works, don't go to the news stations, because while we do have freedom of speech, I just have a feeling the news stations have been using it kind of poorly lately. I don't want to say liberal, I want to say poorly. So if you want the information, go to the CDC site. I'll leave a link in the description down below. Get the information from there. And
if you're sick, stay home. Read a good book.
Or play
Watch
video
some
games.
TV. Play video games. Talk to your friends on the phone.
And last thing is, don't panic, because that's going to be the biggest obstacle, and your actions are going to affect not only yourself, but those around you. So be sure to keep that in mind. So I hope this information helps out. I want to thank you for taking time to watch this video, and stay clean and stay safe out there.
Bye.